Chapter 5 Sample Receipt Topic Guidelines for Specimen Rejection. The proper collection and handling of clinical specimen is essential for obtaining quality test results from a clinical laboratory. Therefore, every laboratory should lay down its specimen rejection criteria that should be implemented if the specimen does not conform to the quality requirements. To have a comprehensive understanding of this critical and important topic, which can affect test results eventually, let's go through a few case studies. A laboratory has received requisition for urine culture and sensitivity in an unlabeled container. Would you like to test the sample or not? The answer is no. The laboratory should reject the specimen of urine which has been obtained in an unlabeled container. Common specimen types like urine, stool, swabs, sputum, and blood, which can be easily recollected and cannot be identified with certainty, should require recollection and can be rejected. Case 2. If the laboratory receives a CSF specimen in an unlabeled container, should the laboratory reject the specimen? The answer is no. The specimen of CSF should not be rejected by the laboratory straight away. Specimens which are less common and more difficult to recollect, like CSF, fluids, tissues, etc., will require the person who collected the specimen to identify it and assume responsibility till it has been identified. If the laboratory still cannot identify the specimen, the clinician who ordered the test should be notified and a repeat specimen should be collected whenever possible. Now consider a case where the laboratory has received specimen in an incompletely labeled container. What do you think should be done in such cases? The laboratory should ensure in such cases that specimens which are labeled incompletely need to be verified satisfactorily by the technician who collected the specimen with the help of the test request form or TRF. If that is not possible, the collection is to be repeated. Consider a case where the laboratory has received a stool specimen in a matchbox for stool culture. Should the laboratory run the test or not? The answer is no. The specimen of stool received in an unsterile container for culture purpose should always be rejected. Culture specimens should always be collected in sterile containers. Specimens received in incorrect containers or with or without appropriate preservative or anticoagulant which would invalidate the results will require recollection wherever possible. Now consider a case where the clinician has requested for a throat swab gram stain and culture from the laboratory. The laboratory has received only one swab for the testing. What should be done in this scenario? Whenever microscopy and culture is requested from a swab, always two swabs or more should be collected. All insufficient specimens will need to be recollected and thus conveyed by the laboratory to the physician or the hospital. Now consider a case where the laboratory has received a patient collected specimen of urine for culture at 12 pm. The specimen was collected at 7 am. There has been a delay of 5 hours. Should the urine culture sensitivity testing be done in this case? Here, the laboratory will have to check if the specimen was collected in a normal urine collection sterile container or a container with boric acid as preservative. Since urine is an excellent supportive medium for bacterial growth, specimen must always be transported to the laboratory without delay. Therefore, urine culture specimens in sterile container without preservative should be rejected if received at the laboratory after excessive delay. The specimen containers which have boric acid as preservative maintain the microbiological quality of the specimen and prevent overgrowth of organism during transport to the laboratory. However, the laboratory has to ensure that minimum 3 ml of urine is present in the container for proceeding with the testing, since boric acid may inhibit certain types of organisms. Now, consider a case where the laboratory has received a request for stool culture and sensitivity from a 95-year-old bedridden patient. The laboratory technician, on gross examination, finds out that the stool specimen is contaminated with urine. What needs to be done in a case like this? The answer is all contaminated specimens should be rejected and fresh samples should be asked for. Now consider a case where the laboratory has received a specimen of blood for performing complete blood counts in a patient. The specimen on examination is found to be grossly hemolyzed. What needs to be done in a case like this? A hemolyzed sample is a suboptimal sample. Suboptimal samples refer to all samples that do not conform to the standards for quality testing. It is important to note the amount of hemolysis needed to affect a test is dependent on the test being performed. In general, slight hemolysis has little effect on most tests. However, it will cause increased test results for specific tests like potassium and lactate dehydrogenase. Samples with slight hemolysis are analyzed and the results reported with a comment indicating the degree of hemolysis and the effect on the test result. Grossly hemolyzed samples can affect the results of many tests. Therefore, a recollection will be requested for most grossly hemolyzed samples. After hemolysis, lipemia can cause significant interference in the analytical results of different biochemical parameters. Therefore, lipemic samples should always be rejected and fresh specimens should be asked for. Another example of suboptimal specimen is if cold chain is not maintained during transport of the sample, it should always be recollected. Specimens received in leaking containers leading to inadequate sample for further processing should be rejected and fresh specimen should be asked for. In case of compromised samples, in critical cases where replacement of sample is not possible, the laboratory shall perform the test and release the reports with suitable remarks to the patient or the requesting physician. This applies particularly to histopathology samples with inadequate formalin and insufficiently sized containers. Therefore, adhering to sample rejection criteria in the pre-analytical phase of laboratory processes ensures quality testing for all specimens. Go back to your laboratory section and count the number of inappropriate samples or forms received in one day. Find out the reason and the possible solution.